BW Healthcare World. In our initiative to talk about quality and patient safety in hospitals, we have with us yet another amazing personality, Father Johnson, who is the Executive Director and CEO at the Rajagiri Hospital, Cochin in Kerala. He's an active member of the key national and international healthcare management forums. And in his efforts to stay abreast with the challenges in the healthcare industry, Father Johnson completed a one-year certificate course in safety, quality informatics, and leadership from Harvard Medical School, Boston in 2020. After spending 14 years as a teacher, his institution entrusted him to build a hospital to serve the community. And that is when the rubber plantation was converted as a space to build this hospital, which is now known as Rajagiri Hospital. It took 3 years to build the hospital, and today, after 8 years of its successful running, they are becoming an example of how quality is being seen by the top leadership. Father Johnson, it's so nice to understand that someone who did not come from a healthcare profession turned it into his mission and built a hospital for the institution. And this is exactly what we're going to talk about today, that is quality and safety really a prerogative of the top management? And this is a part of our series that we are doing with CAHO. So my first question to you, Father Johnson, is quality and safety are fundamental aspects of healthcare delivery. From your perspective, how do you define the quality and safety within the healthcare organization?
I strongly feel, that if you want to be successful in healthcare, you don't have any other choice. Concentrate again and again in quality and safety. Unless you will reach somewhere else. If you don't do that, you'll reach somewhere else. So this is not, a luxury. This is a bare minimum necessity that you have to be a quality person. You have to be a person who is continuously working in patient safety in order to become successful.
Sir, I was in a conference just yesterday, and one of the topics that I was talking of was that a culture in any organization, forget healthcare, in any organization is a top-down exercise. It's a vision of the top management that gets trickled down to the lowest level of execution. Now, in your experience, how does the top management play a crucial role in fostering a strong culture of quality and safety throughout the healthcare organization?
See, as I said, this is a new venture. It's only an 8-year-old organization. So at the beginning, we picked up the talents, doctors from elsewhere. And when these doctors and other healthcare professionals joined Rajagiri, they also carried with them their traditions, the way they practiced medicine. So I made it a point that to bring them to a culture of Rajagiri, the top management has to very well concentrate on that continuous effort. And I thought that being the leader of this organization, I thought I should be there at the forefront. Only that can bring in people to align in this journey of quality. So what I did, I made a core committee for quality, which, I myself lead the entire program, though we have a quality department. Often the quality department and, the people who are involved in it, they will meet people, but it will be more effective when the leader is with the quality department and handhold with the quality department. I think that made a lot of change. And even when we started the construction of this hospital building, parallelly, my quality head and myself had detailed discussions with the JCI leadership, NABH leadership, and the other industry leaders who run leading hospitals in India. So everything went parallel. We never looked at quality as a kind of decoration. That was not a decoration. We took it so seriously. And that is why, even from the very beginning, with the planning of the building and the infrastructure, we also planned the quality journey that we have to undertake in the upcoming institution.
I think it's a very, very important point you've made, Father, because, one must understand that quality and safety is not something that you start when you are when you are running an institution. It has to be a part of the planning itself, and that's where the culture begins. I completely agree with you. And Father, what strategies and initiatives has your organization implemented to ensure that the quality safety standards are maintained and continuously improved upon? Unlike, it should not be something, okay, we have achieved this particular standard and then you take it easy. It has to be bettered with every passing day.
Yeah, that's a very, very important question. Generally, in the field, people think that once you get NABH accreditation or JCI accreditation, then you look at quality, you concentrate on the process protocols only in the next upcoming survey. So what I did, I went for whatever quality accreditations are available, in the ecosystem. Because that will always keep us alert, and we will always be vigilant that this is something that we need to pursue continuously. It's not like once in 3 years you do a survey, get accredited, then wait for the next survey. That will never ever bring in any tangible results as far as patients are concerned. So we have JCI, we have NABH, we have Nursing Excellence, we have NABL, we have ISO certification for FNB, we have Green OT certification, various accreditations for ICU. All these, in order to, it is not because we need that accreditation. It's because we need to equip ourselves always ready to face any challenge in the quality.
Great. Father, can you share some success stories or examples where the top management's involvement and commitment to quality and safety resulted in a significant improvement at your institution?
Yeah. I can. There are many examples. One that I like to share with you is our antimicrobial stewardship. In fact, we wanted that, especially JCI and now even NABH is asking for it. A few years back, I directed my team to take it up seriously, and we need a very, very mature antimicrobial stewardship program. So what happened is, though, the medical leadership, medical directors or nursing head, they all tried, it did not succeed. There are a lot of issues behind that because ours is a referral hospital. So already the patients who reach us already had, used many, even reserved antimicrobials, because everybody needs results immediate. So they don't. So they start in the industry and in the region. There is a very unhealthy practice as far as this antimicrobial programs are concerned. So that did not. I felt that it will not be a successful thing unless I also step in, because there are a lot of challenges when you go through that roadmap. So I defined a new leadership where I was very actively involved. And I also brought in frontliners, not just the critical care specialist, even the nurses, even the supporting staff. We made a core team, and that was not like a hierarchical. This is something like, we various people from various segments, they all came together, and we made it a success story. It is not because the people who worked earlier did not want to happen that, or they were inefficient, because they have a lot of limitations. When the organization feels that the leadership is really behind it, that makes a lot of difference. So now it's going on in a very successful way, and we have brought in some technology also in it, so that a consultant can start the antibiotics for 24 hours on that individual's assessment. But to continue that, there is an IT solution where they need to get a confirmation from an antimicrobial stewardship team. So it's going on well, and I think that can be highlighted as one of my experiences in it.
Father, how do you ensure that quality and safety remain a priority? Because we sometimes begin on a journey and then we encounter speed bumps, we find challenges, we have the cost issues that come up. So, how do we make sure that quality and safety remain a priority, especially faced with organizational challenges and financial constraints?
Yeah, that's again, I think I'm slightly different from the general thinking in it. Whenever we go for any conference, seminars, there I have seen many people trying to project, quality will not add up cost. Quality will finally bring down cost. I think that conclusion is coming from the Western experience in the developed world, where litigation is a major challenge for anything and everything. There can be litigation and a huge compensation, made in many of such cases. Here we haven't come to that culture yet, but we are in the same process. So here, when we introduce quality and when we focus in patient safety, there will be some extra expenses. But if we want to be even financially safe an organization, you look at the even simple the marketing point of view. If you are very serious in quality and patient safety, your success stories will be very, very different than any other organization. So that will bring in more patients. Your organization will be more popular. So there is a cost. There is a cost for quality initiatives. I don't deny that quality will bring down the cost. No, but in the larger context and the years to come, that can be true. That's what happened in the developed world. So financial constraints. If you have financial constraints, definitely you have to be focused on quality and patient safety if you don't have to be in danger. So that's the way how I look at that.
And Father, nobody can succeed. At least I have not seen anyone succeed unless the team believes in the vision, unless the team stands by or is aligned with the objective. Now, how do you engage and involve employees at various levels in your organization to contribute to maintain and improve the qualities and safety standards?
Yeah. I'll just explain what is the structure of our quality initiatives. We have a council called Quality QCC, Quality Core Committee. which I am the leader of that committee, and the quality department is closely associated to that. And the top management, we call that management as executive council. So in the quality core committee, the executive council, myself, quality department, they all come together. And we do on certain frequency internal audits. In internal audits, we have more than, I think, 60 internal auditors. These 60 people come from various ranks and files. Even housekeeping staff work as internal auditors. So people can come from housekeeping, people can come from maintenance. There will be definitely from doctors community, from nursing community. So no segment is kept away in this process. So every department will have their own representation and contribution in all the internal audits. So even if the quality department is not there, still things will work. It will not have an abrupt end. That I am sure about it, because that's the way it's developed in my organization.
And further, we've seen technology advancement, building in efficiencies in everything that we do today. In your opinion, how can technology and innovation contribute to enhancing the quality safety practices within the healthcare organization? Are there any specific technological advancements that your organization has embraced in this context?
Yeah, two things come to my mind. One is regarding the patient feedback system. Initially, our system was that the quality people will, physically visit the patients, take the feedback, and we present that in our quality core committee. But after some time, we started having a feeling that it can be subjective. So we thought, let us make it objective as much as possible, and we introduced a software, an IT solution. We named it as Vector. So it is a QR-based system. All over the organization, it's all pasted. So anyone who wants to use their cell phone, and they can scan that QR code, they can feed in their feedback. So that brought in a lot of objectivity in getting the feedbacks. And based on that, we could evolve a lot of quality improvement projects in my organization. So that I feel that one event where technology made our quality initiatives to a scientific level. The second thing would be we have a hospital information system, but still our IP is not yet EMR. It's still with paper and hard copies. So there are a lot of issues there. For example, even in the prescription, all that, people start writing, and there can be errors in that. So we thought that we will bring in electronic medical records in inpatient sector too. And we are in the process. Initially, we strengthened our Wi-Fi infrastructure, because the slowness can be a block when you go for IP-EMR. So we invested on that. We invested in computer on wheels, and we plan to launch that by November. So I think that can bring in a lot of improvement in accurate data, and a lot of errors can be brought down. That's what my feed. Not yet completed, but everything is going on in a very hectic way.
And Father Johnson, looking ahead, what do you believe is the future of quality and safety in healthcare industry? Are there any emerging trends or challenges that the top management should be prepared to address?
Yeah, I think I don't know whether it's new. I very strongly feel that leadership should be redefined in the quality initiatives. If it is limited to a quality department or one or two people, we will never ever achieve what is intended of the quality initiatives. So leadership is should include the front runners of various segments. It cannot be in a hierarchical order. It should have a horizontal perspective where we need people from various segments. It is not based on their ranks and files, but we need a representation from every aspects of an organization. Only then that will be a success story. Otherwise, it will have a tendency to limit to just get accredited, not beyond that. I think I don't know whether that is a new trend, but I am convinced in that style of running a quality program.
I kind of agree with you, sir. And Father Johnson, based on your own experience and expertise, what advice would you give to the other healthcare leaders who aim to prioritize and improve quality and safety in their organization?
If you want to become successful in a healthcare initiative, there is no other way out. If you don't have a proper quality system in the organization, it is very difficult today to become a success story. Anytime you can be in trouble, and the future is definitely that. So if you want to be successful, it is not a generosity. It is not something which you do as with a sublime motive. If you want to be really a success story, even from the business perspective, quality is the one and the only way forward.
Father Johnson, any final thoughts on or your takeaways for our audience regarding the role of top management in ensuring quality and safety in any healthcare organization? What would be your advice to them?
I am confident and I am having a peaceful day-to-day running of the organization only because the top management is active with the quality initiatives. If you are not into quality, I don't think the top management can be leading an organization in a peaceful mind. You will be always, in danger. That's what it is an essential part of any organization. The leadership can be very confident and can peacefully run an organization if your quality initiatives are robust and it is a continuous program.
Father Johnson, it's been a pleasure speaking to you because my takeaways from this discussion is that one, I think every business leader or any institutional leader in the field of healthcare, for them it should be ingrained as a mindset. Because only if they have a mindset towards quality of the outcomes and patient safety would it become a priority for them. Second is, for it to become a culture, it has to flow down to every person. I mean, even the person who's into housekeeping must understand the role that he or she plays in the patient safety and the outcome of any patient coming to that institution. They must understand their role in it. And it's only then when an employee will feel involved and will make quality as a part of the whole process of anything that happens in that institution.
Very true. Yeah.
So that's what I understood from having a conversation with you. Thank you so much for taking out time to speak with us today. It's been a pleasure to have you.
Thank you, Harbinder. Nice talking to you.
Likewise.
God bless. God bless.
Thank you so much, sir.